Thank you for joining us and welcome to Better Together Live, where we create helpful community connections when it matters most. I am Yamile Bowman, your host and the Community Relations Coordinator here at TherapyWorks. And today I'm very happy to be joined by Dr. Thomas Tarshis from BACA, Bay Area Clinical Associates. Dr. Tarshis is a child psychiatrist, founder and director at BACA. I read your curriculum vitae, Tom, and I'm very, very impressed. And I will need more than 50 minutes to talk about all your achievements. So thank you so much for being in the community and all you do for this wonderful community. Thank you.
Oh, my pleasure. Thanks for having me.
Absolutely. So we started Better Together Live to highlight local resources like BACA to offer expanded access to support for our local community. So this is very, very helpful that you're here. Thank you. So Tom, before I jump into all those questions, can you tell us a little bit about yourself? I did a little bit, but I'm sure there's so much more there. So please, the floor is yours.
Yeah, I grew up in the Bay Area here on the San Jose, Los Gatos border, and went to UC Berkeley undergrad, which has always stayed near and dear to my heart. But then I ventured off and spent 6 years in the Midwest doing a master's degree in medical school, and then made it back to Arizona, to Phoenix for a community training program for adult psychiatry, and then came back out to the Bay Area to Stanford for a research and child psychiatry fellowship. And so I've been all over and traveled the country, and most people probably don't know is I was going to go into pediatrics, hematology, oncology, and then the chair of our medical school pediatric department asked if there was something else that I enjoyed. And when I mentioned, I really like this child psychiatry rotation, she really persuaded me to enter this field, saying that it needed a lot of work. So some days I'm very grateful for that. Most days I'm grateful. Other days maybe
you're like,
yeah, maybe not as grateful. But regardless, she was correct, and it's been just quite a journey since then.
Well, we're very lucky you chose to do this. Absolutely, thank you. Yeah, thank you. I know you also contribute to a lot of different publications, correct? Regarding that, yeah.
So I was really on a academic track and thought I would do research and have an academic career. And my research focus was bullying and victimization in schools, and very passionate about that. But a light bulb moment was that when I was doing some of my training at Stanford back in the mid 2000s, a long time ago, and realized there's so many desperate families that can't find help for their suicidal teens or anxious fourth graders, that really it didn't fit with my public health training to continue on an academic career when we needed to do more to help people in need right now.
Yeah. Wow. That's great. Thank you. So Tom, what is BACA and how long has it been helping the community?
Very good. So BACA is two different entities. So when BACA number one, or nonprofit BACA, is actually Bay Area Children's Association, and that's the clinic I started back in 2007 is when we saw our first patient, and that still exists. It's our nonprofit partner. And then what I realized, though, is I didn't have any business training, even though I had done some, I'm a software engineer before medical school and other pieces. So I had a belief that non-profit equals good and for-profit equals bad, which was naive at the time. So for the first 10 years, though, BACA just existed as a non-profit entity. And then in 2017, our clinical... We've grown to so many sites and had so many employees, and because we never pushed hard on fundraising, it didn't make sense to keep all of our services in the nonprofit. So we made new BACA, Bay Area Clinical Associates, to take advantage of some of the better benefits of being a taxable entity. And it's the same mission, vision, values. Nothing has changed. And so that was a good lesson to learn, that it really doesn't matter what type of entity you are. It's just keeping your mission same. That's important.
Love it. I love that. Who does BACA support?
So BACA is a community clinic. So our mission is that any youth, which is 26 and under, any family that walks through our door, regardless of ability to pay, could receive the top gold standard evidence-based treatments to address their mental health issues. And that's what we've just been pushing at for all these years. And as you know, it's desperate. It's always been desperate times to try to find mental health providers. And now the pandemic has
increased.
Created, it's gotten a lot more attention around our field, which is great, but it has also created more need for services. And we're, as a lot of other agencies, we're doing the best we can to try to
accommodate everybody in need. Yeah, totally. Do you offer medication management at BACA?
Yeah.
Right? Okay.
So we're a diverse entity that has literally every mental health provider under one roof, including we train all providers. So we have master's level associates and students and licensed therapists, social workers, and marriage and family therapists. We have psychologists. We have a psychology training program and have pre-docs, postdocs, and graduates. And then we have relationships with Stanford and UCSF and some other schools for helping to train their doctors. And one thing about our field is it's very important to be collegial and bring everyone in and work as a team approach. And we really embrace that at BACA. We're all a first name basis. And I mean, we work with youth, so we try to be fun and friendly.
That's right, yeah.
Try to provide everything under one roof to make it easier for families.
Right, your approach kind of have to adjust to the youth, right? It's with all of you, good communication. Can you talk about your IOP and your outpatient program? Because I know for BACA, that's pretty big.
Yeah, so in mental health treatment, as with other levels of medical care, there's varying intensity levels. So my outpatient is for the most mild symptoms. And then for our first 6 years of existence, we really struggled with someone needed more than just once or twice a week outpatient, sending them to hospitals, which unfortunately is another broken part of the system. And often families don't really need hospitalization, and they might get over-medicated, and it might do more harm than good. And so what we could do as a clinic was create an intensive outpatient program where kids and families could come 3 or 4 days a week for 3 hours a day. And that level of care is often enough to avoid going into the hospital. The next two levels up are a partial hospital program and inpatient services, which we don't provide. And I think right now, if there was more access to IOP and moderate level services, maybe we could decrease the number of unnecessary hospitalizations, but there's a lot of pieces of the system that need to be fixed. So we're working hard to at least provide those.
That, yeah, no, wonderful. Are you currently offering group therapy?
So some of our groups are going on. So we have a very cool Dungeons and Dragons group that has worked well, doing it virtually, and that's going to start up again in a month or so. Our intensive outpatient programs, we've kept them virtual to this point, although the pandemic continuing on and on is starting to drain on our teenagers especially. So we're figuring out what to do. Of course, it's changing every day, so it's difficult.
It's a difficult time to do that, and I understand. I mean, being a teenager, and the whole year they were studying via computer Zoom, so going for therapy, it's just harder. But
and I think for teens especially, being in person and having that connection with your peers without being, and where we can sort of take people's phones away from them during the time. We think that that's really important, and we're doing an analysis to see how are our outcomes during the pandemic with virtual services. And for a lot of things, for adults or young adults, I think a lot of things will turn out to be even, and our no-show rate is drastically lower, so that's good. But whatever is not doing as well, we have to address and come up with solutions to.
Right. You mentioned about your Dungeons and Dragons, and you also have the Minecraft social skills group. I think those two are absolutely wonderful, and it's such a great idea to engage with your clients that way. Can you explain a little bit the ages of both groups and how it works?
Sure. And so our Minecraft group I developed back in 2013 when a lot of parents were unhappy or had a hard time getting their kids to attend social skills group, which there's a lot of different reasons you might want your kid to go to a social skills group. So I thought, well, let's take advantage of Minecraft, which is a great game, and the virtual world is a great setting to practice social skills. And so that we've run groups between as low as first grade up through eighth grade for Minecraft. We were hoping to go back live in September. That group's going to be a little bit harder to do online only because the extra supervision you need in person, but with the pandemic dragging on, we'll see what we can do.
Right.
Dungeons and Dragons group is a great program being developed by one of our psychiatrists who started when they were still in training. And that's been a little older age ranges, maybe 6th grade through 10th grade. And that's,
that's great. Yeah.
It allows for some very creative strategies.
Yeah. I'm not very, I don't know much about gaming, as you know. I mentioned this before, but I have sons that they are, and they play with yours, and I think the approach through gaming and doing all this, I think, is wonderful. That's such a great idea.
Yeah, we really try to embrace creative paths to delivering care, and we love to come up with something new and then study it and see if it works and then share that information.
I'm sure they appreciate that. Absolutely. Yeah. So what are the most common mental health illnesses that comes through your door, Tom?
Yeah, so definitely anxiety and depression are the top two. After that is behavioral issues or family conflict is probably a better way to say it. And so those are really the vast majority of our diagnoses. And then we have a number of, high functioning autism. We have some more severe mood disorders like bipolar disorder.
Right.
But the majority, if you look at family counseling, parent work, disruptive behaviors, and anxiety and depression, that covers the bulk of it, definitely.
Yeah. And with the pandemic, and I'm sure everybody's talking about the same thing over and over because we're still in it. But what was the increase in what you saw? Like more like depression or anxiety?
Oh,
probably both. Yeah.
That's a good question. We do have some research. We're presenting that just the overall increase in requests has gone up by 60 or 70%.
Wow.
Because of the pandemic. We're actually, one of our students is about to do a project to look at if there has been a change in the diagnoses presenting as the pandemic's gone on. And we suspect that maybe it's shifting a little more to higher anxiety, but we're going to do that analysis and then we'll present those findings.
That's wonderful. Tom, I have a question for you. I don't have a clinical background, so my apologies if it's kind of like a silly question, but where does anxiety come from? What triggers a kid to have anxiety? Because if you look at the world around, our kids, where we live, I'm not going to generalize the population, but they have, I want to say, like, access to so many things. Why they come with anxiety? We see that all the time at Therapy Works. What's triggering that?
Yeah, this is as is true with most medical disorders, of which mental health diagnoses are, everything is a combination of genetics and environment.
Yeah.
So it's that same question that two 8-year-olds might see a car accident, and one 8-year-old, sees it and it affects them for a little bit, and then they forget about it, and there's no other consequences. And the other 8-year-old can't get it out of their mind. They worry they're going to be in a car accident or their parents will. And this is, people's reactions to different events probably depends on your genetics, how are mom and dad's anxiety. But then there is a component of what's going on in the environment, right? So everyone is in a trauma right now from the ongoing pandemic for so long. It's sort of a shared trauma state. So that's putting a lot of environmental loading on people's inherent nature regarding anxiety. And so it's unknown completely, but for everything, it's this combination of genetics and environment. And because everyone is in the shared high stress trauma environment,
true. Yeah,
we're seeing more come out.
That's absolutely true. Yeah. Well, I want to be respectful of your time, but is there anything else you would like to share with us?
Oh no, I mean, we're lucky. We're lucky to live in the Bay Area, which is better in some areas. And actually, our mental health care system is not where it should be, considering what we have access to. But
true, yeah,
we're trying to get some more positive things going and resources out for our patients and families, and all the mental health workers that are also under a lot of stress. So. This will end at some point, and looking to peers and friends as we are for support during this time is super helpful. So
yeah. I talked to somebody in the past, and we were saying, like, the pandemic someday will go away, but the trauma that's leaving behind is gonna last way longer than we think. So thank you again for being here with us. And if somebody wants to reach out to you guys for information, can you share your website or a number that they can call?
Yeah, website's easy, BACA.org, and that has a lot of good information. And my email's on there also, and I always welcome anyone to feel free to reach out to me directly. And my obsessive compulsive nature likes to clear that inbox, so I try to respond quickly.
I know you do. Thank you. And for us, our philosophy here at Therapy Works is very simple. We are better together, Tom. And everything we do is in support of our community. And we understand sometimes taking the first step for help, it's not easy. But when they are ready, we're here to help. And if you want to learn more about us, visit mytherapyworks.com. Tom, again, thank you so much for your time today, and I hope you have a great weekend.
Thank you, Yamile.
Okay, I'll talk to you later. Thank you so much.